The topic I chose to discuss and implications and impacts to the nursing profession is from an article published in the Duluth News Tribune on August 20th, 2015, discussing the issue of a patient having documented wishes and family rescinding resuscitation orders. The importance of this issue on nursing practice is the importance of needing well-documented advance directives such as a MOLST, healthcare proxy, and a detailed living will. The importance of continuing collaboration between healthcare providers, patients, and families, and the importance of educating patients of sound mind to update advance directives as needed. The ethical principles associated with families rescinding patient wishes are non-maleficence, beneficence, autonomy, and fidelity. By going against the patient wishes and prolonging suffering is demonstrating non-maleficence. By continuing with the patient wishes and not acting upon the family wishes and beliefs is benefiting the patient and demonstrating beneficence by doing no harm and benefiting the patient. Autonomy is the patient's right to decide and have say about their well-being as long as they are of sound mind. Are we violating the principle of fidelity by not following the patient wishes? In order to advocate for the patient, it is important for nurses to follow and uphold patient wishes in order to minimize unwarranted, unwanted, or unnecessary medical treatment and patient suffering. Remembering that the patients have a right to self-determination and have the moral and legal right to determine what will be done with their own person. According to Provision 2.1 of the ANA Code of Ethics, the nurse's primary commitment is to the recipients of nursing and healthcare services, whether it is the patient or client. When the patient's wishes are in conflict with those of others, the nurse needs to help resolve this conflict. Where conflict persists, the nurse's commitment remains to the identified patient. Some of the impacts and implications of the nursing profession regarding the issue of rescinding advance directives is that nurses need to be knowledgeable in regards to legal documents, in regards to the patient's end-of-life wishes. In order to uphold the ethical principles, nurses need to uphold patients' autonomy and wishes in regards to their specific advance directives. Having well-documented and updated advance directives impacts healthcare professionals' decisions in various situations within the patient's hospital stay. Also, healthcare professionals need to remember the importance of educating families and patients of palliative care services and the death and dying process. The six-step process of ethical decision-making is to determine care for the patients and families to follow through with patient wishes. As the bedside nurse, it is important to gather all relevant information in regards to end-of-life wishes and medical treatment. Step 2, we need to identify the ethical problem. Nurses may face moral distress knowing the family is going against patient wishes. They also may face the ethical dilemma due to their personal beliefs of this being unethical. Step 3, we will use the deontology theory and the nurse's duty to the patient. When the healthcare proxy wants to rescind the patient wishes, nurses need to bring the focus back to the patient. Step 4, we will explore alternatives. Nurses need to collaborate with other healthcare professionals such as doctors, NPs, and in an ethical dilemma such as rescinding advance directives, possibly collaborating with an ethics committee. Step 5, we will complete the action that is ethically correct for the patient by advocating to continue to proceed with their wishes and documented advance directives. Step 6, we will analyze the outcome that will assist the nurse and healthcare team to conclude if they made the correct ethical decision and had the best possible outcome for the patient.